Okay, the next topic we're going to cover is the intercostal veins. And so our objective is the following to identify the intercostal veins, including their tributaries, course, and anastomoses. All right, so here we have a picture of the section of the thoracic wall, and there we have an intercostal vein. So what we're going to do is discuss how you get blood from this intercostal vein back to the heart. All right, here we have a right view, a lateral view on the right side of the thoracic wall, and we're going to talk about intercostal veins, which segmentally drain tissue from intercostal spaces and the overlying skin. And so there in yellow are showing the ribs, and in orange are the costal cartilage to articulate the ribs to the sternum. And then there, just to orientation in pink, is the diaphragm. And then in blue, there's our intercostal veins. The upper intercostal veins, you can see the front and the back, but not the middle, just to make the picture not so confusing. You can see the entire intercostal veins along the bottom. So there's an intercostal vein. There's an intercostal vein, and what we see is segmentally all the way down on each side, we have these intercostal veins that fill each of the intercostal spaces. And so in this picture, we see a rib and we see an intercostal vein there. In this other picture, we see a rib and an intercostal vein there. Now notice, when we look at just one intercostal vein, blood in that vein can go towards the front, or blood in that vein can go towards the back. And so what we see happening is that double arrow is that blood in intercostal veins can drain to the front or the back. If blood drains to the back, they go into what's called the azygous system of veins. If blood drains towards the front, they go into this internal thoracic vein, so that horizontally at every segmental level are intercostal veins, but in the front and the back is a vertically coursing vein that collects these tributaries of the intercostal veins. Let's talk about them in more detail. There's the azygous. I call them the azygous system of veins, and that's the azygous vein where the arrow is at, and it courses up, and then it goes over the right primary bronchus and dumps into the superior vena cava, and then blood dumps down into the heart. That's how we get blood from the right intercostal spaces on the back into the heart. Now, let's take that green arrow and then turn, so now we're looking directly at. Instead of a lateral view, it's now an anterior view. So vertically on the right side is the azygous vein. Vertically on the left side is the hemiazygous vein at the bottom and accessory hemiazygous vein at the top. So why is it called the azygous system of veins? Well, let's take a look at the word azygous. The letter A means A, without. And then zygous, or zygote, think zygomatic arch in the cheek. A zygote is in sperm and egg fertilizing. It means a union, a marriage, a bringing together, a coupling, a pair. They call this a zygous system of veins because these veins are not paired. You have on the right side the azygous vein that vertically runs up and down and drains all the right intercostal spaces, but you don't have a paired structure on the other side. In fact, you have this hemiazygous and accessory hemiazygous veins. But the one thing that these azygous system of veins all do is they drain blood. The azygous vein takes from every intercostal space, drains blood, and then goes to the superior vena cava. The hemiazygous and accessory hemiazygous vein drain blood. Accessory hemiazygous from the upper intercostal spaces, and hemiazygous vein from the lower intercostal spaces. But look how both the accessory and hemiazygous veins drain into the azygous, and that blood will all go back to the superior vena cava. And so now let's take a look at the internal thoracic vein. Well, what we see is this vertically coursing vein like suspenders on either side of the internal surface of the sternum. And that internal thoracic vein courses up and then dumps into this brachiocephalic vein. And blood from the brachiocephalic vein drains down into the superior vena cava. And blood from the superior vena cava drains into the heart. So there's a posterior intercostal veins, and there are anterior intercostal veins. Posterior, anterior. And then they come together and they form an anastomosis laterally in the intercostal spaces. That word anastomosis means a union, a coming together, a joining. So intercostal veins in a nutshell. What we see is that intercostal veins are paired. We have posterior intercostal veins that drain segmentally into the azygous system of veins, or in other words, the right intercostal spaces drain into the azygous vein. And the left upper intercostal spaces drain into the accessory hemiazygous vein, and the left lower intercostal spaces drain into the hemiazygous vein. And then we have anterior intercostal veins that drain segmentally directly into the internal thoracic vein. And there, folks, are intercostal veins in a nutshell.